The osteoarthritis, or OA, is one of the leading causes of disability worldwide, affecting millions of people and significantly impacting quality of life. The main goal in managing the OA is to control pain and improve function, all while minimizing the risk of treatment-related side effects. But with so many available pain relief options, including acetaminophen, topical Nsaids, and oral Nsaids, patients and clinicians often face tough choices. Which medication works best? And which is safest for long-term use? In this video, we'll explore the latest evidence comparing these common treatments, helping you understand the benefits and risks of each. When it comes to knee osteoarthritis, three main types of pain relievers are commonly used: acetaminophen, topical Nsaids, and oral Nsaids. Acetaminophen is often recommended for mild pain, while Nsaids, either applied directly to the skin or taken by mouth, are used for more persistent symptoms. However, recommendations and clinical guidelines vary, and there's ongoing debate about which option should come first. Some guidelines favor topical Nsaids, others recommend oral Nsaids, and some still suggest acetaminophen. This confusion makes it crucial to look closely at the latest research comparing these medications head-to-head. To answer which treatment is most effective and safest, researchers conducted a network meta-analysis of 122 randomized controlled trials involving over 47,000 participants. They also analyzed real-world data from large patient databases, using advanced statistical methods to compare outcomes. This approach allowed them to assess both the short-term and long-term effects of each medication, looking at pain relief, improvement in function, and the risk of side effects like gastrointestinal or cardiovascular problems. By combining evidence from clinical trials and real-world practice, the study aimed to provide the most reliable guidance for patients and doctors. So how do these medications stack up when it comes to relieving pain and improving function? The analysis found that topical Nsaids were more effective than acetaminophen for improving function in the short term, but not significantly better for pain relief. When compared to oral Nsaids, topical Nsaids showed similar results for both pain and function. This means that, for most patients, topical Nsaids can offer comparable benefits to oral Nsaids, and may be a better choice than acetaminophen for improving daily activities and mobility. Safety is a major concern when choosing pain medications, especially for older adults or those with other health conditions. The study found that topical Nsaids had a lower risk of gastrointestinal side effects, such as stomach pain or bleeding, compared to both acetaminophen and oral Nsaids. In real-world data, topical Nsaids were also linked to lower risks of all-cause mortality, major cardiovascular events, and gastrointestinal bleeding. Oral Nsaids, while effective, carried higher risks for these serious side effects. This makes topical Nsaids a safer choice for many patients, especially those at risk for stomach or heart problems. While clinical trials are the gold standard for testing medications, they often include only select groups of patients and may not capture rare or long-term side effects. That's why the study also looked at real-world data from thousands of patients in the UK. The findings confirmed that topical Nsaids were associated with lower rates of death, heart disease, and gastrointestinal bleeding compared to both acetaminophen and oral Nsaids. These results support the idea that topical Nsaids are not only effective but also safer for everyday use in a broad patient population. Based on growing evidence, many clinical guidelines are now shifting their recommendations. The American College of Rheumatology and other major organizations now strongly recommend topical Nsaids as a first-line treatment for knee osteoarthritis, while being more cautious about acetaminophen and oral Nsaids due to their side effect profiles. This change reflects a better understanding of the balance between benefits and risks and aims to help patients achieve pain relief and improved function with fewer complications. It's important to note that while topical Nsaids show clear advantages, no treatment is perfect for everyone. The study had some limitations, such as relying on indirect comparisons and not being able to fully account for all individual patient differences. Also, while topical Nsaids are safer overall, they may still cause local skin reactions or interact with other medications. Patients should always consult their healthcare provider to choose the best option based on their unique health profile and preferences. In summary, for people with knee osteoarthritis, topical Nsaids offer a strong balance of effectiveness and safety, outperforming acetaminophen for function and matching oral Nsaids for pain relief, but with fewer serious side effects. This makes them a recommended first-line treatment for many patients. However, individual needs and risks should always guide the final decision. As research continues, staying informed about the latest evidence can help patients and clinicians make the best choices for managing knee OA and improving quality of life.